Hello, I'm Dr. Vivek Vardhan Veerapaneni, a consultant pulmonologist at Swasa Hospital, Narayanguda, Hyderabad. This video I'll be talking about vaccines for COVID, booster dose for COVID. So vaccines. So there are 2 points before I go to this topic. One thing, first point is, are vaccines working at all? The second point is, why am I getting COVID so many times? First wave I got, second wave I got, and again I'm getting it now. So does it mean that my immunity is less, or am I immunocompromised? That is the second most common question that's being asked. The first one. So is vaccine working? Definitely. Vaccines are working. That is the reason why most of us are safe right now. Vaccine. 1 dose may not work as much as 2 doses. 2 doses, yes, it does work really well. However, for this particular Omicron, 3rd dose, that is a booster dose, is giving very good results. It's mounting a very good amount of antibody response in the body and is even preventing particular Omicron infections. Or if you're getting infected in spite of vaccination, it's showing only mild symptoms. So I urge you all to take a booster dose of any of the vaccine of your choice, like even Covaxin or Covishield or Sputnik or whatever vaccine, but just get it done. Especially if you're more than 60 or especially if you have any comorbidities. Vaccination is the key to prevent any moderate or severe COVID. Second point, I got COVID already. Why am I getting it so many times? Right? So this particular Omicron has mutated so much. It is the most mutated coronavirus we have seen yet. More than 32 mutations. It's unbelievable. Like probably it was mutated in an immunocompromised host, like a HIV or AIDS patient. So that is the reason why we have seen so many mutations in this particular virus, and there are more than 30, and many of them in the spike protein, that is the area that binds to our body. So this is the reason why it is behaving completely like a new different virus. It's not even behaving like a typical COVID wild virus or a beta or a delta virus. So that's the reason why the symptoms are also slightly different and also mild. So it's not about the problem in your immunity. It is not the problem with you. It is the problem with the virus. So that is the problem now. So virus has mutated so much, no matter how good your immunity is, you are going to get it if you are not going to take precautions. Jumping into the precautions, what are the precautions? We know that is mask, not just any mask, but N95 mask or a double surgical mask is going to give a good protection to you. Second thing is vaccination. We know, we have discussed till now. The third thing is physical distancing. Physical distancing is extremely important. I'll tell you one reason why this is very important, because to avoid gatherings, most of the COVID cases are of asymptomatic cases. That means they don't even know that they have COVID, and you want to definitely know that they don't have COVID. So you invite them to a party, so there you, or a function or a gathering or something, meeting, so where that person can be a potent spreader, and he spreads the virus and you get the symptoms, or some of those people who are susceptible get the symptoms. So to avoid all this chaos, it's better to avoid any social gatherings, because we have so many asymptomatic carriers where you cannot identify you by your thermal gun or any other test. So it's better to avoid all these, and also sitting in groups. The fourth thing is having too much hygiene, using too much sanitizer is also bad. It can lead to some other problems. And I've seen so many OCDs being developed because of this particular COVID pandemic. We have seen so many cases who wash hands every 5 minutes, not required. So wash them only if required, whenever you touch someone, otherwise whenever you are in contact with a COVID patient. So I urge you in the end that our precautions are the only things that are going to save us apart from vaccines. So mask is must, mask mandate, vaccine is must, and also physical distancing. So I urge you all to spread awareness but not virus. So I hope you understood something out of this video, and please spread the video so that more people will get to know about new things about this particular virus. Thank you.
We'll be covering all topics which commonly affect patients on a day-to-day basis.
For more this type of doctor advices or opinion or any other things,
దయచేసి డాక్టర్స్ అడ్వైస్ ఛానల్
లైక్ చేయండి, కామెంట్ చేయండి, షేర్ చేయండి.
సబ్స్క్రైబ్
to this channel, Doctor's Advice.
10 మందికి ఉపయోగపడేలాగా చూడండి. థ్యాంక్ యూ సో మచ్.